even if the individual is not expressing pain explicitly, it could be indicating that they're experiencing a lot of chronic discomfort and pain in their bodies. So that's something that I always like to assess and pay attention to when I'm trying to understand how pain is interfering with someone with neurodivergence. And with that, I'm now going to turn it over back to Dr. Wilson to talk about how caregivers and providers can help.
So I think the good news about pain in kids being biological and psychological and social is that even if we aren't always able to directly change biological factors, caregivers and providers can help make a big difference in terms of positively impacting psychological and social factors. And here I just put these little icons of the places in this cycle where parents and providers have the potential to really make a positive impact and to sort of intervene for the better. So we want to talk a little bit about what comprehensive treatment for chronic pain in children and adolescents looks like. So first, a comprehensive approach recognizes that because chronic pain is biopsychosocial in nature, treatment should also be multi-pronged and multidisciplinary. And these chronic pain clinics are often a team approach that includes a pediatric anesthesiologist or other physician, pain specialized psychologist, physical therapists, and sometimes an occupational therapist, nurses, or other professionals. They recognize that there is not a single solution. We like to say that having chronic pain is like having a car with 4 flat tires. So we often see kids who have tried many things to manage their pain, which haven't been successful. And when you ask more about it, the story is often, we tried this medication and it didn't work. We tried PT and it didn't work. We tried acupuncture and it didn't work. And they've been inflating tires, but just one at a time. And what is really needed is a coordinated set of multiple approaches to help sufficiently calm the nervous system and support increased function. So this is a very individualized approach to treatment, and it's important that as you're considering a plan for treating a particular child, that it's really tailored to that child's needs and that the plan is feasible for the child and family to achieve. These treatment programs typically focus on function, not just pain reduction. There are certainly many interventions that help us reduce the perception of pain, but it's not just pain itself that we want to treat. We're often focusing also on how to help kids return to what their valued activities are. And most of these programs are outpatient programs, but for youth with more severe impairment, there are more intensive programs like inpatient or day treatment programs available. And there's a few reasons to think that these programs are likely to be appropriate for neurodivergent youth. First, they're often housed in pediatric hospitals where providers are comfortable working with developmental differences. And the chronic pain treatment approach for working with children is typically tailored to an individual child's needs. And then pediatric programs also involve parents and caregivers who know these children best and are in a great position to be able to support progress at home. There's also a few things that we would recommend in terms of adapting pediatric chronic pain treatment for neurodivergent youth. So first, like Dr. Han mentioned, really addressing sensory supports and sensory dysregulation. Physical therapists who work with kids with chronic pain often use some of these approaches in treatment for chronic pain, and these will be perhaps more a core part of treatment for neurodivergent youth. Neurodivergent youth typically need more individualized behavioral and social supports in school settings to help manage pain. A pediatric pain psychologist can provide those kind of consultations and recommendations to school staff. And we also know that directly addressing executive function challenges can really be useful as part of pain treatment. And both occupational therapists and psychologists can help with addressing some of these things. We often know that also know neurodivergent youth may need some extra attention paid to the aspects of life that are routine that we know can impact pain. So we talked a little bit about sleep, but also just balancing nutrition, movement, daily activities, and routines can really make a positive impact on pain experiences over time. And that is an important area to focus on as well. And then finally, providers can sometimes forget that taking time to learn from a child or teen about their special interests can go a long way. You can use this connection to your advantage if you're a clinician. And then we want to just wrap up with a few tips for caregivers and some take-home messages. One is to start low and go slow. So if you have a child who is struggling to walk to the end of the driveway, you want your starting point to be a short, slow walk that's gradually increasing over the course of weeks. We don't want to start with expecting kids to run a 5K. We also want to be mindful of negative interpretations of the child, like they can't do something or they're acting out. And just remember that some of these behaviors may be due to unaddressed sensory overwhelm or executive dysfunction. It can be helpful to provide visual clues and physical reminders related to pain management. So when pain is at a really high level, executive function is the first thing to go for all of us. And having a visual or physical cue to remind you of different coping approaches can be really helpful. And then similarly with non-compliance, if you have a child who's not willing to participate, try reducing the initial expectation and moving more gradually. And keep calm if you can. So when kids are in pain or sensorially overwhelmed, parent distress or provider distress can really amp this experience up. And finally, finding support and taking care of yourself. I like to say that caring for a child with any one of these conditions is what I call black diamond parenting. So really finding the balance between when you push and when you accommodate for kids with these conditions can be really complex and tricky. That's something that pain psychologists can also help with. So these are our take-home messages. And I think understanding some of this basic pain neurobiology can be really helpful. Understanding that pain may be different in neurodivergent individuals is important, and that treatment is available, and you can support your child's comfort and help improve their function over time. And then finally, we have this resources sheet that is available for download that includes online and other resources that we recommend, as well as information about how you can find pediatric pain clinics around the country, and some research articles. So I'll stop there so we can move to Q&A.
Thank you both so much for such an informative presentation. Dr. Han had mentioned the association between hypermobility and ADHD, and I'd like to let everyone know that Attitude Magazine actually has a feature coming out in the winter issue on the emerging research involving hypermobility and ADHD and inflammation and ADHD. So very relevant. The winter issue will be on sale in certain retail stores and in subscribers' homes in early November. So thank you for mentioning that. Before we start the Q&A, I'd like to share the final results from today's poll question. We asked, if your child has ADHD and or autism and suffers with chronic pain, is it related to headaches, musculoskeletal issues, tummy troubles, or something else? 34% said tummy troubles, 31% said musculoskeletal issues, 28% said headaches, 6% said something else. And we asked if these children have missed a significant amount of school as a result. 45% said yes, and 55% said no. Now to your questions. I have two similar questions that are about when professionals appear to be uninformed. One question is, how can we advocate for ourselves with clinicians who say they don't see anything wrong? I'll start with that. And either one can answer.
I think advocating for yourself and your child is, or your child is an important part of this care. I think surprisingly, veterinarians get more education about pain than human doctors do. So people are always shocked to hear this, but doctors don't get a lot of specialized education around chronic pain and pain neurobiology. And I think that's changing a little bit now, but you may need to provide some education. One of the things that one of the resources on the resource list is something that's called the Comfortability Program. And that website has a ton of helpful information, and I think is where I would point providers as a first step to sort of understanding a little bit more about that. I don't know, Dr. Han, if you have other ideas.
I was just going to say, don't get discouraged when you're trying to figure out how to help your child, and imaging or different medical testing is coming back negative. It doesn't mean that your child is not experiencing pain, because the concept that Dr. Wilson talked about with nociplastic pain, and that pain can exist even without the presence of tissue damage, that's a concept that I think a lot of pain doctors and individuals who specialize in chronic pain are very much aware of. And so I think sometimes finding a clinician who understands those aspects of chronic pain, using those resources that Dr. Wilson just mentioned, can be really helpful as well.
Okay, the other similar question is, how can I advocate for my child in the school setting when teachers don't understand chronic pain issues?
So this is one area where I think I enjoy supporting my patients the most, is as a pain psychologist, being able to support documentation for the schools, so that teachers, school administration is all in having a deeper understanding about chronic pain and what this student is going through. So one of the best ways is to have someone who understands the needs of the child, potentially advocate or write a letter that would initiate a 504 plan where an individual could get accommodations at school. And in that letter, in that plan, I would recommend having accommodations that are specific to these things that we talked about in today's talk that might be influencing an student's experience of pain in the school environment. I think that can go a really, really long way. And there's ongoing efforts to help school personnel and teachers understand more about chronic pain, because it is such an invisible condition sometimes. There's no overt signs of injury at times, which can make it hard to advocate for your child. But I think that's one of the best things that can be helpful. And Dr. Wilson, I didn't know if you have other thoughts.
I think that's what I would recommend too. I think for a lot of kids with chronic pain, we're working to try to help them to be able to attend a full day of school. And part of what the accommodations often are is helping school staff understand that pacing the day is going to be important, and that, you know, we may not be able to expect them to return to full-time school attendance day one. This is going to be a gradual process. But having a quiet place to take breaks, having them be able to access comfort and things to sort of sensorily calm themselves down during the day is going to be an important part of helping them stay there for the whole day. So.
Okay. Are there pain triggers, and how do we find out what they are and how to stop it? I know you mentioned this, but how can a parent dig deeper to find out the source of a child's pain if there is a trigger?
Yeah, I think this can be so tricky. I think when pain is episodic and happens every once in a while, it's much easier to identify potential triggers than when once it's at a point where it's happening every day. It's much harder to identify those specific triggers. And sometimes we see that really, especially for this nociplastic pain, it is just an accumulation of stress and sensitivity that kind of tips the scale to experiencing pain rather than a very specific trigger. I don't know, Dr. Han, when I work with patients, I have a really terrible analogy about, and I use this thinking about headaches in particular because they're, it's just I think it's a good example, but I have this analogy of thinking of it like your nervous system is a boiling pot of water. Stress is like potatoes that you're putting into the pot. And whenever the pot overflows, that's when you get a headache or get pain. And a lot of the things we're talking about today for neurodivergent youth, like they may just have a little more water in their pot to start with. And we're looking at preventative things to kind of scoop out some of that water, lower it as much as we can. And then sometimes you can control potatoes and sometimes you can't, right? So there's going to be potatoes that come occasionally. And if your water level's low enough to start with, it may not boil over, right? So this is a convoluted metaphor. But the idea is that there's sort of this threshold at which the nervous system is just, it's too much. And then we're experiencing pain. So sometimes it's really hard to identify super specific triggers.
And I would also say that the neurobiology or the nervous system dysregulation that's going on during those moments, it might not be as important to identify the specific trigger, but then to help teach the individual relaxation strategies that are actually helping to balance out the nervous system. And so when an individual is experiencing pain, increasing those helpful relaxation strategies and small skills and tools and behaviors that help the individual feel more regulated in the moment, that's going to make a big difference over time.
Okay. A college counselor writes, I'd like to know how to support neurodivergent kids in college who experience pain. Some students with autism hyper-focus on the pain, and that's all they talk about. How can I help them learn healthy coping strategies rather than keeping them stuck in how bad the pain is?
I have a few thoughts about this. So when there is hyperfixation, something that I try to be aware of is like, is this kind of a cognitive style or something that is also happening in other areas? So is there hyperfixation about multiple different things? And do the hyperfixations lead to distress? In the context of hyperfixating about pain or having a lot of worry thoughts about pain because of the fear avoidance model that we just described, that does make an individual more vulnerable to then having the brain detect more potential signs of threat and danger, which can actually amplify or turn the volume up on the pain over time. So one thing is to help the individual build insight into that process, not in a blaming or shaming way, but just to say, oh, this actually makes so much sense that you'd be experiencing discomfort and pain and having a lot of worries about it because we're hyperfixating on it. In lieu of that, we can use strategies from cognitive behavioral therapy to shift the thinking patterns. We can also come up with some replacement behaviors or things that we know are adaptive coping strategies for chronic pain. And so I would say even for the individual trying to support the college student, for them to be aware that the hyperfixation could be amplifying the pain signal and that the pain is real, but that there's other ways that we can kind of start to redirect the student and build up these other more helpful behaviors. I think that could be a really helpful strategy for supporting the student.
Yeah, and I think anything that you can do to help that student access things that are available on campus that are potentially like engaged distraction too, like being able to give yourself an opportunity for those hyperfixation thoughts to kind of go down a little bit because you're involved in doing something else. Ideally, those are things that are pleasant and comforting to the individual. So.
Okay. Someone writes, my neurodivergent kid is 20 years old and suffers from several chronic conditions. Honestly, there are times when I've doubted whether the pain is real, psychosomatic, just an excuse to retreat from the world, or something I caused. I don't know what to do. Do you have advice for this mom?
I mean, I think this is such a great That's such a great question, and I think is really the experience that a lot of parents have. We certainly would like to first say this is not something that parents cause. I think that kids are born with all sorts of varieties of nervous systems and have all varieties of experiences that sort of lead them to where they are at. I also think that it's really important to recognize that pain is a real experience for individuals at every age. And is there sometimes an element for kids of sort of milking it or really like using the pain to get out of things? Yes. And the pain is real. I don't think those are necessarily mutually exclusive all the time. So we'll see a little bit of a mix of both, but I don't know that it's helpful to do anything but deal with it as it's a real experience that kids are experiencing. And when they are stressed out and avoiding things, that is also then probably amplifying the pain experience. So I think it can just be really, really tough. And there are, even in the young adult years, things that parents can do to help support these kids. I don't know, Dr. Han, if you have other specific thoughts.
I think the fact that this parent asked this question is showing that they're showing concern and that they really care about their child. And I think that goes a long way. And so one of the things that can be really helpful is validating the child's experience of pain, even if it seems to not make sense or that there's not an identifiable trigger that there's a trigger that's not like to the magnitude of what the child is experiencing. So validating the pain experience, I think, is really important, just like what the definition of chronic pain, those 6 points that Dr. Wilson mentioned, that it's a subjective experience and it's worth acknowledging. And then I think it's really helpful to start to think about, what is the pain trying to communicate? So pain is our body's protector. So at some level, in that moment of discomfort, the brain is perceiving some sort of threat or something that our brain is saying, I don't want to do this right now. I can't do this right now. So there's a level of threat or fear in that moment. And so thinking about what the pain's trying to communicate can then give us a sense of like, oh, how could we adjust the environment or do the thing that we want to do slightly differently and make accommodations or modifications in a way that's going to reduce that threat signal or the extent to which the brain is perceiving the situation as dangerous or uncomfortable. I think that can be really helpful to start to approach the pain in a non-judgmental way. And then the other thing that I wanted to mention is that just because there's not clear evidence of tissue damage or any structural abnormalities in the body, doesn't mean that the pain isn't still very real because of what we talked about, going back to that concept of nociplastic pain. And so I think that concept it can really be validating to parents and also very validating to the child as well. So the point of hope is that, okay, there are things that we can do to help increase comfort and reduce the fear of pain over time. Pain might be trying to communicate something. How can we really understand the individual's needs and experiences? What are they trying to communicate? And how can we help them communicate that and get their needs met in ways that are adaptive and helping them achieve their goals as well?
Okay. Well, unfortunately, that has to be our last question because we're out of time. But Dr. Wilson and Dr. Han, thank you so much for joining us today and sharing your research and clinical expertise with our ADHD community. We really appreciate it.
You're welcome.
You're welcome. Thanks so much.
And thank you to today's listeners. If you would like to access the event resources, visit attitudemag.com and search podcast 577. The slides and recording are posted a few hours after each live webinar. If you're listening in replay mode, simply click on the episode description. Please know that our full library of Attitude webinars is available as a podcast. It's called the ADHD Experts Podcast, and it's available on most streaming platforms. We hope to see you again next Tuesday for our webinar on helping tweens and teens with ADHD to tackle homework independently. And the following week, you won't want to miss our free webinar on managing stress and emotions at work. Please make sure you don't miss future Attitude webinars, articles, or research updates by signing up to receive our free email newsletters at attitudemag.com/newsletters. Thanks, everyone. Have a great rest of your